During history taking of a client admitted with newly diagnosed Hodgkin's disease, the nurse would ask the client about which expected symptom. 1. Weight gain. 2. Night sweats. 3. Severe lymph node pain. 4. Headache with minor visual changes. Answer 2. Rationale. Assessment of a client with Hodgkin's disease most often reveals night sweats, enlarged painless lymph nodes, fever, and malaise. Weight loss may be present if metastatic disease occurs. Headache and visual changes may occur if brain metastasis is present. To ensure client safety, which assessment is most important for the nurse to make before advancing a client recovering from an appendectomy from liquid to solid food? 1. Bowel sounds. 2. Chewing ability. 3. Current appetite. 4. Food preferences. Answer 2. Rationale. The nurse needs to assess the client's chewing ability before advancing a client from liquid to solid food. It may be necessary to modify a client's diet to a soft or mechanical chopped diet if the client has difficulty chewing because of the risk of aspiration. Bowel sounds need to be present before introducing any diet, including liquids. Appetite will affect the amount of food eaten, but not the type of diet prescribed. The nurse is caring for an obese client on a weight loss program. Which method would the nurse use to most accurately assess the program's effectiveness? 1. Monitor client's weight. 2. Monitor client's intake and output. 3. Calculate client's daily caloric intake. 4. Frequently check client's serum protein levels. Answer 1. Rationale. The most accurate measurement of weight loss is weighing of the client. This needs to be done at the same time of the day, in the same clothes, and using the same scale. A client has developed atrial fibrillation resulting in a ventricular rate of 150 beats per minute. The nurse would assess the client for which effects of this cardiac occurrence. Select all that apply. 1. Dyspnea. 2. Flat neck veins. 3. Nausea and vomiting. 4. Chest pain or discomfort. 5. Hypotension and dizziness. 6. Hypertension and headache. Answer 1, 4, 5. Rationale. The client with uncontrolled atrial fibrillation with a ventricular rate over 100 beats per minute is at risk for low cardiac output caused by loss of atrial kick. The nurse would assess the client for palpitations, chest pain or discomfort, hypotension, pulse deficit, fatigue, weakness, dizziness, syncope, shortness of breath, and distended neck veins. The nurse is performing a respiratory assessment on a client being treated for an asthma attack. The nurse determines that the client's respiratory status is worsening based upon which finding? 1. Loud wheezing. 2. Wheezing on expiration. 3. Noticeably diminished breath sounds. 4. Increased displays of emotional apprehension. Answer 3. Rationale. Noticeably diminished breath sounds are an indication of severe obstruction and impending respiratory failure. Wheezing is not a reliable manifestation to determine the severity of an asthma attack. Clients with minor attacks may experience loud wheezes, whereas others with severe attacks may not wheeze. Also, the client with severe asthma attacks may have no audible wheezing because of the decrease of airflow. For wheezing to occur, the client must be able to move sufficient air to produce breath sounds. Emotional apprehension is likely whatever the degree of respiratory distress is being experienced. The nurse is assessing the casted extremity of a client for signs of infection. Which finding is indicative of the presence of an infection? 1. Dependent edema. 2. Diminished distal pulse. 3. Coolness and pallor of the skin. 4. Presence of warm areas on the cast. Answer 4. Rationale. Manifestations of infection under a casted area include a musty odor or purulent drainage from the cast or the presence of areas on the cast that are warmer than others. The physician needs to be notified if any of these occur. Dependent edema, diminished arterial pulse, and coolness and pallor of the skin all signify impaired circulation in the distal extremity. A client's telemetry monitor displays ventricular tachycardia. Upon reaching the client's bedside, which action would the nurse take first? 1. Call a code. 2. Prepare for CARDIOV or SIO. 3. Prepare to defibrillate the client. 4. Check the client's level of consciousness. Answer. 4. Rationale. Determining and responsiveness is the first assessment. Action to take. When a client is in ventricular tachycardia, there is a significant decrease in cardiac output. However, assessing for unresponsiveness helps determine whether the client is affected by the decreased cardiac output. If the client is unconscious, then cardiopulmonary resuscitation is initiated. A client diagnosed with hypertension has been taking a prescribed calcium channel blocker for approximately 2 months. The home care nurse monitoring the effects of therapy would determine that drug tolerance has developed if which is noted in the client. 1. Decrease in weight. 2. Increased joint pain. 3. Output greater than intake. 4. Gradual rise in blood pressure. Answer. 4. Rationale. Drug tolerance can develop in a client taking an antihypertensive such as a calcium channel blocker, which is evident by rising blood pressure levels. The physician needs to be notified, who may then increase the medication dosage, change medication, or add a diuretic to the medication regimen. The client is also at risk of developing fluid retention, which would be manifested as dependent edema, intake greater than output, and an increase in weight. This would also warrant adding a diuretic to the course of therapy. Joint pain is not associated with this form of tolerance. A client experiencing trigeminal neuralgia tic douloureux asks the nurse for a snack and something to drink. Which is the best selection the nurse would provide for the client? 1. Hot cocoa with honey and toast. 2. Vanilla pudding and lukewarm milk. 3. Hot herbal tea with graham crackers. 4. Iced coffee and peanut butter and crackers. Answer 2. Rationale. Because mild tactile stimulation of the face of clients with trigeminal neuralgia can trigger pain, the client needs to eat or drink lukewarm, nutritious foods that are soft and easy to chew. Extremes of temperature will cause trigeminal pain. An adolescent is admitted to the orthopedic nursing unit after spinal rod insertion for the treatment of scoliosis. Which assessments are most important in the immediate postoperative period when considering the client's neurovascular status? Select all that apply. 1. Pain level. 2. Urinary output. 3. Ability to move all extremities. 4. Capillary refill in all extremities. 5. Ability to flex and extend the feet. 6. Ability to detect sensations in all extremities. Answer. 3, 4, 5, 6. Rationale. When the spinal column is manipulated during surgery, altered neurovascular status is a possible complication. Therefore, neurovascular checks, including circulation, sensation, and motion, needs to be done at least every 2 hours. Level of pain and urinary output are important postoperative assessments, but are not specific to neurovascular status.